Let's talk healthcare. Recently, the United States has backed the implementation of a groundbreaking HIV prevention drug. It signals a game changer in the healthcare system worldwide. But, and this is the but, patients on the continent, that's here in Africa, could face markups of up to 300%, meaning what costs about $60 elsewhere could rise to as much as $240 here, largely due to fragmented and multi-layered supply chains. So what does this mean for the availability and affordability? More importantly, how can Africa health tech innovators step in to bridge the gap, ensuring that access isn't defined by geography or income? To unpack these questions, I'm joined by Dr. Tosin Oshinubi, who is the director at Salient Advisory, a consulting firm that's been closely tracking the role of innovation in strengthening Africa's health supply chains. Doctor, thank you so much for joining us. You're very, very welcome.
Thank you for having me.
Talk about the impact of this potentially HIV preventing drug and what its impact could be.
Yeah, so the HIV/AIDS drug is a groundbreaking one because it helps to prevent HIV. And unlike what we've seen with the other drugs that we have for HIV, those ones, you have to take them every day. This particular groundbreaking drug, you take it just twice a year, and that's a lot. It's going to improve compliance, adherence for people taking the medicine. It's also going to help, eliminate the discrimination that we have associated with these drugs. Because there's the privacy, if someone is taking a drug to prevent HIV and you're taking it every day, sometime or even after a while, people will get to know that you're actually taking drug for HIV, and it's associated with discrimination, with stigma. But this one is just twice a year, and it's just going to improve everything around adherence, around discreteness.
Now, what the inflated cost, the fact that it's potentially patients on the African continent could face this, potential 300% markup. Why is that? Why do drugs? Why are they so much more expensive here?
Yeah, so the challenge we have in Nigeria is that our supply chain is heavily fragmented. Unlike what you see in Francophone Africa, where you have just maybe three to five big distributors managing everything, Nigeria is heavily fragmented. And what it means is that if drugs is brought in, maybe from the manufacturer, but from the time it moves from the importer to the key distributor and then other smaller distributors, before you get to the last mile, there are about 5 to 8 or even more middlemen in between. And they're all business people. So what they do is they had markups to cover their costs, to cover their profit. So by the time it gets to the end users, it's 3x or more the original price.
Yeah. Well, middlemen have to eat. Everybody has to eat.
Yeah.
But what is the impact of, so many potential HIV, carriers and not being able to get access to the drug?
Yeah, but the one thing I need to say, this particular drug is to prevent one from having HIV.
In the first place?
Okay. So there are a number of people that are high risk, young people, people with multiple sexual partner, people that give themselves drugs through syringes, So this particular drug will actually prevent them from having HIV. So that's the first thing. And if they're unable to access this drug, the implication is that the disease will continue, the infection will continue, and we may not be able to stem the tide of the infection. That's one. The second thing is that if we're unable to stem the tide, it's going to have impact on the economy, because it affects people within the largely working population. So it's going to affect the national productivity of the country. It's going to affect even the tax base. It's going to strengthen the tax base of the country. It's going to affect even public expenditure that should have been channeled to other things like education, building infrastructure, to taking care of these people. And the family level too. You can imagine the money you could have used sending your children to school, you're using it to treat yourself, or debt that could push them back to poverty. So the impact is huge if they don't have access to these drugs.
Doctor, I don't like demonizing middlemen, because I feel everybody has a role to play in an economy when you think about supply chains. But every time we talk about the cost of food, the cost of this and that, middlemen, and I guess middle women, are always demonized, right? So there's some research that shows, though, if you eliminate them, you could bring down costs by about, 20, 30% or so. Why has it been tough to remove middlemen and middle women and these folks that are in the middle of these supply chains? Why has it been so difficult?
So, the system in Nigeria is fragmented.
Yeah.
and these people are established. They're well entrenched into the system. It's going to take a while to be able to. And I would not even say we should remove them. I would say those leveraging technology to bridge this gap should step up the game. We need more of them because what they do is that the technology helps to bridge people bringing in the drugs into the country down to the last mile. Instead of passing through so many middlemen, you bring that technology straight down to them, thereby bypassing one or two or maybe more middlemen. And that way, they're able to pass the savings of this drug down to the end users.
Gotcha. Now, speaking of the end users, Doctor, let's talk about direct-to-pharmacy models from healthcare startups. As far as the lessons or the approaches that can be replicated here, how would that work with this particular drug? Talk about the business model there, and then how that can be,
Yeah. So the health tech startups that we have in Nigeria and also even across Africa, what they do is they use technology to digitize how they plan for to procure drugs. Down to the logistics of it, to the distribution, and then to the end user.
Right.
And they can deliver directly to businesses, like pharmacies or clinics or hospitals, And that's what the technology, it brings about transparency in the entire system, So what this helps to do is that because they see the data of what's moving, they can be able to predict better what they need, for the drugs and for the pharmacies. Also, they are connected to a number of pharmacies. Many independent pharmacies are connected to them. They're able to pull demand from all these small pharmacies. And because they have that power, bargaining power, they're able to get the drugs cheaper, either from the importer or the key distributor, and then again passing the savings down to the end users.
Fantastic, Doctor. We can. I want to talk to you about maybe we'll bring you back. Pharmacies have become the de facto hospitals for so many Nigerians that can't afford higher things, but they just play such a big role in the supply chain for getting healthcare over to Nigerians. But what about governments? And when I say governments, Doctor, I prefer to decentralize governments down to state governments, right? Because everybody seems to keep having this federal government's conversation. I see federal government can solve everything. Can you bring the conversation down to the state governments and how they can work with the respective pharmacies within their territories to get these medicines down to the people that need them?
Yeah, I may have to take it back to
federal governments, because of the role it plays.
Yeah, because of the role they play, especially for this particular drug.
Okay.
Federal government recently launched what we call Medipool. Medipool aggregates medications or drugs from on behalf of various programs. Because what we've been having until then was that each program procured their own drug. So we have parallel supply chain, which makes it very expensive because they only procuring for their own area.
Okay.
It's going to be much more expensive. But what government have now done now is to set up a Medipool that procure on behalf of everybody. So they have the bargaining power, to engage internationally to say we need these drugs and we are buying this volume. Because they have that volume, they're able to push the price down. And then from there, they can now distribute to the states. And the thing is, each state has, at least to a large extent, they have their DMAs, and also their central medical stores. And from this, they can actually get it down, to the end users more affordably.
Dr. Oshinubi, I tell you, I wanted to continue the conversation, but we've run out of time. We'll have to bring you back. This is a fascinating conversation, and I thank you for taking the time to talk about how this can be solved in terms of getting this HIV preventive drug over to Africans at large, with governments and pharmacies and startups working in harmony with each other. Dr. Tosin Oshinubi, Director at Salient Advisory, thank you so much for your time.
Yeah, thank you so much for having me.